Where we are right now is the Austin neighborhood of Chicago. Patients were coming to us saying that they needed a safe place to go in the community where they could get treatment for their opioid use disorder.
We now are seeing patients that come from more rural areas, someone who may have been prescribed prescription opiates for, post-operative pain management. And then prescription opiates became more difficult to come by. Patients would then turn to heroin.
I went to detox. My mind started to clear, the fog started to vanish. I started facilitating classes about recovery. A lot of guys used to come up to me afterwards and they used to let me know how I helped them out.
We really felt like we had the ability to bring the medical and physical expertise, the behavioral health, mental health expertise. What we didn't have was the peer expertise. With the help of the CVS Foundation, we were able to integrate peer recovery support specialists into our interdisciplinary team. Peer recovery support specialists are a non-revenue generating service. The CVS Health Foundation and the NAC funding allowed us to build our capacity to find a way to make these positions more financially sustainable. And with the Learning Collaborative, we were able to learn best practices from other organizations.
The peer support specialists are able to impact the patient's lives by letting the patients know, hey, if I can do it, you can do it. That they too can be successful in recovery, whether that's harm reduction, whether that's abstinence, or whatever they want to do.
There were a number of challenges associated with integrating peer support specialists into the program. How do we incorporate individuals who have some sort of criminal background associated with their substance use? We looked at our hiring policies and incorporated positions that allowed for more flexibility.
My background is a nurse, so I usually say patients or clients. When I hear the peer support specialists talking, they're always saying my peers. This is what I'm going to bring back to my peers. So I think it's awesome that they have a safe space where they could come together to help each other.
And when I see these individuals, I see me. I have to give them the gift that I got to let them know that it gets better.
Hey, girl, how you doing, baby?
Hey, you, how you been?
I'm all right.
Patients who are hard to reach in the program, who need to follow up with health care, who need to receive their medication, are able to get a visit from a peer support specialist and see what can be provided to make sure that those barriers to care are being broken down and that they're returning to the clinic for appointments.
One of our peer recovery support specialists, Tatiana, was a patient and actually continues to be a patient with PCC. She has since moved out of a participant of the groups and is now leading groups.
We'll lead off with Michelle.
Groups give patients a chance to be among others who can empathize with them and to also get support.
I always tell the patient, if there's something going wrong and you feel you need to make a phone call this office. I'm gonna set up you an appointment. Ask for Daryl, ask for Tatiana, ask for anybody at PCC.